It is now our great honor and privilege to introduce the Class Day Speaker of 2022. Dr. Joya Mukherjee is a physician, educator, mother, singer, and activist. She is trained in infectious disease, internal medicine, pediatrics, and public health. Since 2000, Dr. Mukherjee has served as the Chief Medical Officer of Partners in Health. At PIH, Dr. Mukherjee coordinates and supports efforts to provide high-quality, comprehensive health care to the poorest and most vulnerable around the world. She's an associate professor at the Division of Global Health Equity at the Brigham and Women's Hospital and in the Department of Global Health and Social Medicine at HMS. Dr. Mukherjee teaches infectious disease, global health delivery, and human rights to health professionals and students from around the world and directs the master's degree program in global health delivery at HMS. Her scholarship focuses on health delivery, universal health coverage, and human rights. She's a recently published author of the textbook An Introduction to Global Health Delivery, Practice, Equity, and Human Rights, published by Oxford University Press in 2017 with the second edition in 2021.
It is also special to get to introduce Dr. Mukherjee as she marked her own beginning at HMS 5 years ago. We still remember her empowering words and grounding energy, and recall her reminding us that talent is not exclusive to this or any institution. The world is filled to the brim with talent, but it is opportunity that is more scarce. A total social justice warrior and a community-driven leader, we are so excited to welcome you to the stage, Dr. Joya Mukherjee.
Get to take the mask off. I've dodged COVID all this time, so hopefully it'll stay. Thank you to Deans Daly, Gianobile, Hundert, and Saldana, and the esteemed faculty of Harvard Medical School and Dental School. Thank you to the Harvard custodial staff who have set up and will clean this quad, and the many, many workers and staff who support this beautiful event. Of course, our deepest thanks goes to the family and friends that stood behind these brilliant young people. Congratulations to the Harvard Medical and Dental School class of 2022. And thank you especially for selecting me to deliver this address in this first in-person class day since the start of the 2019 pandemic, or COVID-19 pandemic. Thank you, I love you too. I am deeply honored to share this hopeful day with you. The practice of medicine and dentistry is rooted in hope. Hope that your collective action, our collective action, can lead to healing and change. Yet you are commencing your practice at a very difficult time, one marked by despair and confusion. In the looming backdrop of this beautiful day is war, racial violence, gun violence, climate catastrophe, and COVID-19. In fact, the COVID-19 pandemic is a pandemic of pandemics in the United States and around the world. It has worsened the pandemic of poverty, exposed the violence of racism, and demonstrated the epic failure of the market alone to deliver health outcomes that are equitable. Healthcare professionals, doctors, nurses, dentists, respiratory therapists, and many staff that it takes to take care of the sick, the dying, and the dead have been tested, sickened, exhausted, and even succumbed to death. And as usual, those who have borne the brunt of this pandemic are the poor, the marginalized, the vulnerable, the sufferers of pandemics, both biological and social, that have long plagued humanity. Dang, Joya, I thought you were going to talk about hope. I am. That was supposed to laugh. Thanks. I offer you this. Hope is as important now as it has ever been. Hope is an act of solidarity with those who are suffering. Hope leads us not to a desire for normal, but toward action to achieve a better future. It powers a willingness to wade into the messy waters of sickness and suffering, to analyze the milieu of social injustice, and to address the consequences and root causes of the disparate suffering that you will see. Hope with analysis and action is a radical rejection of cynicism and pessimism. It presents an alternative and a brighter future. Hope is an antidote to despair. And to those of you more scholarly, less touchy-feely folks, make no mistake, hope is evidence-based. It is rooted in an analysis that change, whether incremental or earth-shattering, is possible. Many of you will not only hope for a better test, a better treatment, a better outcome, you will work for change, and you will bear witness to change as it occurs. As many of us on the faculty, many of your parents, elders have. When we choose hope, we side with children like Yesenia and her mother, Claudia. Yesenia was 12 years old when I met her decades ago in Peru. She took care of her younger siblings each day as her mother went off to sell newspapers. She had become, as her mother Claudia told me, a skeleton of a child. Her raspy breath and sunken eyes broadcast her diagnosis, tuberculosis. Doctors blamed Claudia for a belief in witchcraft. They even blamed Yesenia, this child, for cheeking her medicines and spitting them out. But Yesenia and her mom told me a different story. Claudia took Yesenia to daily visits at the health center, even when transportation to clinic sunk the family into debt. Yesenia took her medicines regularly, despite the fact that the cost of care resulted in her and her family having very little to eat. My proximity to Yesenia was thanks to a dedicated community health worker who walked with me up a steep road that wound onto a barren hillside to Claudia's tiny home. A family picture wreathed in flowers suggested that Claudia's husband had died. Tuberculosis had claimed his life, Claudia told me. And he, Doctora, took the pill every day for years. At that time, there was no treatment for drug-resistant tuberculosis in Peru. And knowing that Yesenia had the same strain, likely that her father had, with no hope of cure in the country, could have been the end of the story. But we, Partners in Health, had secured some drugs for resistant cases of TB. But the Ministry of Health would not let us use them on children. So we had to create a bit of trouble, generate a bit of evidence, and apply a bit of pressure. We had to create a team to analyze and mitigate the root causes of Yesenia's illness: poverty, hunger, overcrowded housing, and a system that didn't recognize the disease she had. With Claudia, Francisco, a mason, improved the ventilation and expanded her home. Una abuelita, or a grandmother from the community, made a highly nutritional blood pudding that she offered to supplement Yesenia's nutrition. A nurse and militant fighter for the poor, Dahlia, suggested as an ally a genteel pediatrician who had seen too many deaths from TB, and he served as our shepherd for policy change at the ministry. A driver, Senor Valdez, dedicated every day to fighting traffic in metropolitan Lima to shuttle Yesenia and Claudia to the pediatric hospital. And even Yesenia herself, at 12 years old, she vowed to fight. When I asked her what might help her remain hopeful, she said, "Doctora, El Principito, The Little Prince." It was a book she read in school before she had to drop out because of her sickness. I like the asteroid B612, the one the little prince lives on. I would like to draw him and his planet because I am excited to think that another world is possible. I gasped. The next time I saw Yesenia, I arrived with a copy of El Principito and a pen and a sketchbook. And the news that working with Yesenia herself and this mighty team of doctors, nurses, community health workers, drivers, grandmothers, and mothers, we had received permission to treat Yesenia's illness. You can clap for that. It was pretty awesome. Our collective hope and action cured Yesenia, who is now a college graduate and a graphic designer. That good trouble meant that Yesenia's case and holistic treatment became evidence for change. Published as a part of a small series of just 16 children who were treated for drug-resistant TB in Peru, that article, singular article, changed policy in Peru, allowing the treatment of MDR-TB for hundreds of other children in the country that year alone. Collective work to save this beautiful girl, along with the testimony of the Peruvian National TB Program, Partners in Health, and others, changed World Health Organization policy and informed the creation of the Global Fund to fight AIDS, TB, and malaria's TB treatment program for children with drug-resistant TB. Measure that impact factor. What seemed as far away as asteroid B612 became a reality for children around the world. Another world was possible. Hope and action in solidarity with others will help you cure a sick child, change a local system, and even move the levers of power. While hope is never rewarded with a complete fulfillment of a utopian ideal, it moves among us in innumerable acts of dignity, mercy, healing, and justice. It can trouble the waters of the status quo. I have no doubt that you will save lives, contribute to a community, and even change the world, but none of you will do it alone. I have never done it alone. The true art of medicine, as many of the speakers pointed out, is rooted in the fundamental action of caregiving, which is a team sport. Family members are on the front line of caregiving. They know their loved ones. Listen to them, talk to them, be with them. Nurses know the minute-to-minute progress of a patient, the family dynamics, the nuance. Social workers evaluate the home situation, know about the community resources. Talk to your teammates, all of them. The custodial staff who cleans the room, the dietitian who brings the food. Giving care is an ultimate act of love and an act of hope. And hope is an act of communion. Hope defined my dear friend, Dr. Paul Farmer, Collocatronis University professor, chairman of the Department of Global Health and Social Medicine at HMS, chief of the Division of Health Equity in the Department of Internal Medicine at the Brigham and Women's Hospital, and founder of Partners in Health. I was so fortunate to work for a quarter of a century with that brilliant and hopeful man, my brother and friend. Paul's practice of social medicine was based on the radical hope that change is possible and indeed necessary. His writings were a roadmap for change. In his book, Pathologies of Power, Paul urged us to make the provision of services central to human rights work, and to listen to the sick and abused, those most likely to have their rights violated. He urged us to make room in the academy for serious scholarly work on the multiple dynamics of health and human rights, the pathogenic effects of social inequality, including racism, gender inequality, and the growing gap between rich and poor, and to design programs to remediate inequality. Paul wrote that in 2003. We are there today. We are there, my friends. We are always there. Dr. Farmer's call to proximity with, listening to, and caring for the sick, and analysis of the causes of inequality, and work to remediate these forces engenders a particular type of hope, a revolutionary and radical hope. This prescription, though, from the good doctor and from me to you, is not easy. Wading into the waters of racism, poverty, patriarchy, colonialism can dampen anyone's hope. Your eyes will become tired from seeing the seemingly unchanging earth, and it is often easier to turn away and to focus only on the biomedical pathology or what you think is possible based on the status quo. But I urge you not to. Hope is powerful, and radical hope and action can be your superpower. When Moses parted the Red Sea, it was hope that brought his people to the shore to wade in the water. They believed another world was possible, and make no mistake, it was not a clean cutting of the water with a welcome mat and a nice footpath. It was troubling of the water, ups and downs, highs and lows, but navigable. It is said that Harriet Tubman herself led people to freedom and gave them hope by seeding their struggles in that biblical context, by singing, "Wade in the water, wade in the water, children, wade in the water. God's gonna trouble the water." Today, as you undergo this magical transition from medical and dental student to doctor and dentist, I know I speak for all of our faculty in saying we have faith in your talents, we have faith in your intellect, and we have faith in your hearts. You embody the hope for the future. You will create new knowledge, give comfort, alleviate suffering, and cure disease. As a doctor, as a dentist, you will experience sorrow, loss, and tragedy. And what will buoy you in difficult times is your proximity, your work with an interdisciplinary team, and the practice of the moral discipline of cultivating and maintaining hope. Know that human history is shaped by an infinite number of hopeful acts. Your contributions may be focused on something as tiny as DNA or as expansive as society itself. But whatever path you take in medicine, in dentistry, maintain the radical notion of hope, the belief that our collective action can and even must bring about change. And wade in the water. Wade in the water, wade in the water, children, wade in the water. God's gonna trouble the water. Thank you very much.